Well, good morning, Queensland. Sorry for a slight delay, but we have gathered some new information this morning. So I can advise that we have one new community case in Queensland. This person is a close contact of the person we identified yesterday from the aviation training facility. This person lives at Bargara Waters on the Gold Coast. We also have one additional case that will not be recorded in Queensland numbers as they were tested positive in New South Wales, but is a truck driver who has travelled onto the Gold Coast area, lives in Queensland and has been in the Gold Coast area from the 25th to the 27th of September. So that means we have 18 active cases currently. We did 11,208 tests yesterday, so we're seeing those testing numbers come up, but we want to see even more people coming out and getting tested, particularly on the Gold Coast as well now. We had 21,713 vaccinations, which now brings us to 64.58% first doses in Queensland, 45.6% second doses. So what these two new cases mean is that we will be extending immediately the directive in relation to mask wearing to the Gold Coast LGA as well as the Brisbane City Council and the Moreton Bay Regional Council LGAs that we announced yesterday. And we will also be putting the directive in place as far as vulnerable facilities in the Gold Coast LGA. So that will mean that there will be restrictions on people accessing hospitals, aged care, disability facilities and correctional services facilities. We will be monitoring this very closely over the next 48 hours, but we know that we need to be looking very closely, of course, at all of those close contacts that have attended the training aviation facility, and our contact tracers are working closely with the aviation, the airlines and also the staff that work at those facilities. Good news overnight, one of those hotels that one of the gentlemen stayed at yesterday, that all of those close contacts have come back negative overnight and they are now in isolation. So that's really good. That's what we want to see. The quicker we can contact trace and identify people, get them tested and get them isolating means we can contain this virus quickly in the community. So the message is clear today for anyone from South East Queensland, but anyone who's been travelling in these areas. Please, if you have any symptoms, no matter how mild, a headache, a runny nose, please go get tested. We will be monitoring testing capacity on the Gold Coast and in the Brisbane City Council Moreton Bay areas, again working with private pathologists to request those on the Gold Coast to allow people to come in and get tested without needing a referral, and also just making sure that we have the times available for people to come in and get tested. We know that the virus is on our doorstep. We have been saying this for some time now, from New South Wales, ACT, Victoria. These cases reinforce this again. The genome sequencing that came back on the two different clusters yesterday show that this virus is not linked to any existing Queensland cases, that these are linked to interstate and potentially overseas. So that's good news. It shows that we don't have any evidence of the virus still circulating within the community from previous clusters, but it shows once again the risk to Queenslanders of this virus coming across our borders. So please go out and get tested, making sure you are wearing your masks at all times, indoors and outdoors, unless you can socially distance outdoors. We know masks have made a difference. We continue to ask people high level of compliance. This is critical. Also, if you are going to get a test, you must isolate until you get your results. Please don't think that you can pop down to the shop or the chemist after you've had your test and then go home. Please make sure that you are isolating until you get your results. There will be additional exposure sites going up on the website. Please check the Queensland website regularly to see if there are new sites on the Gold Coast, Brisbane or Moreton Bay area or anywhere else for that matter, once we get the opportunity to talk to these individuals and understand their movements. There certainly is more exposure sites from the gentleman who has driven as a truck driver from New South Wales and back again. There are new sites coming up, including Coles and Liquorland. There's some fast food places as well. So we do want people to make sure they're checking these websites. And the last message is this. We have new clusters again. Victoria are recording increasing numbers and deaths from this virus. New South Wales is reporting deaths every single day. Today is the day you should go out and get vaccinated, remembering that it is at least 5 weeks from when you get your first vaccine that you are fully covered, because you have to wait 3 weeks if it's Pfizer, and then 2 weeks after that until you get full protection. And those timeframes change with Moderna and AstraZeneca as well. So it's a minimum of 5 weeks from when you get your first vaccination that you are fully covered. So don't wait. Today is the day. Come out and get vaccinated, because this is how we will protect our community. It will keep you safe, your loved ones safe, and ensure that we don't have our ICUs overwhelmed by people who need ventilators and whose lives are at risk. So please, come out and get vaccinated today. That's how you can do your bit to protect our community. I'll now hand over to Dr Young to just talk in more detail about these recent cases. Thank you.
Thank you, Minister. So one new community case in Queensland. This is a gentleman in his 50s and he's a close contact of our aviation training worker. So we know that it's linked. He lives in Biggerah Waters and has been out in the Gold Coast area while infectious. So we'll be putting up sites, exposure venues on our website. So anyone in the Gold Coast or anyone who's been in the Gold Coast in the last week, please go and check that website. He had had 2 doses of vaccine and had been fully protected. So we just need to work through and see what the risk from him is. Then the second case is a gentleman who's been tested in New South Wales, who works as a truck driver. He lives in Gavin in the Gold Coast and regularly moves between the Gold Coast and Sydney, stopping along the way at a lot of communities. So he's been tested in New South Wales and is positive, and he's been infectious in the community for 3 days in the Gold Coast. And I'm just going to read the suburbs he's been in the Gold Coast while infectious. So Mermaid Waters, Merrimack, Narang, Surfers Paradise, Mermaid Beach, Miami, Palm Beach and Currumbin. So there are all of those exposure venues going up on our website. So it's very important that people check those exposure venues and follow the instructions for each venue as to whether you're a close contact, a casual contact, a low-risk contact. But anyone in the Gold Coast today, absolutely anyone with the most slightest of symptoms, please come and get tested, because we now have 2 people who live in the Gold Coast who've been out in the Gold Coast while infectious, so that's very important. Now, all of these are new clusters. So I got back the whole genome sequencing results last night for our 2 cases from yesterday, if you remember those 2 cases. And both of them are Delta, and neither of them have clustered with any case in Queensland. They've clustered with cases in New South Wales and indeed with the United States. And that fits with that aviation worker who works in that facility that we know international pilots use. So we're just working through at the moment. Those sequences have been loaded up onto our national database to see if there's any closer link that we can find, but we know they're not linked to any case in Queensland. So we have these brand new outbreaks happening every day. So yesterday I asked and put orders in place for increased mask wearing in the Gold Coast and Moreton Bay areas, and I also limited to those vulnerable facilities. So today I'm extending that to the Gold Coast local government area. It's really, really important that people follow those mask requirements and that they don't attend vulnerable facilities. We still need to protect our most vulnerable because we don't have high enough vaccination rates. So I ask everyone, if you have not yet been vaccinated, please come out today. It's really, really important because you won't get that full protection for at least 5 weeks after Pfizer and 6 weeks after Moderna and 12 weeks after AstraZeneca. So please, there is plenty of vaccine. We have sufficient vaccine for every Queenslander 12 years of age and older who wants to be vaccinated. So no matter where you are in the state of Queensland, please immediately come and get vaccinated because we're seeing every day more cases come into Queensland. This is not a continuation of those previous outbreaks. These are brand new outbreaks. I'm quite happy our previous outbreaks, due to the fantastic work done by all of those people involved, all of those schools and communities, they're totally controlled. These are brand new outbreaks and we don't know where the new outbreak will happen. So yesterday you saw an announcement for our truck driver, freight driver protocol, and we'll be enforcing that. I know it's harsh on those truck drivers, but I really need you to follow those instructions. I need you to get vaccinated and I need you to stay in your residence or in your truck. If you're in Queensland, within that 14-day period of travelling to an area where there are known cases, so Sydney and a lot of those communities in New South Wales. That's really, really important. Hopefully for not too much longer as we get our Queensland community vaccinated so we can protect people. But we know, as we're seeing time and time again, vaccination is not enough to stop people getting infected and passing on the virus. They will be fine. We've seen time and time again that if you're fully vaccinated, it's very unlikely you'll end up in ICU and extremely unlikely you'll die from the infection, but you can still pass it on. So we need everyone to get vaccinated who can possibly get vaccinated so that those people are protected. And we do know that it reduces the risk of passing it on but doesn't eliminate it. So please, everyone, 12 years of age or older, come out immediately. Go to one of our pharmacies, GPs or vaccine centres and get vaccinated today. Thank you.
Good morning. Overnight, the Queensland Police processed more than 6,500 vehicles at our road border points right across the state and over 500 passengers coming in through our airports. What I will say is we are checking and processing 100% of vehicles crossing the border and 100% of people travelling from the hotspots into Queensland. We're still seeing people turning up at our border checkpoints, chancing it. Please don't do that. Please get online, make sure you have the right border pass and the right paperwork to be able to enter the state. Overnight, we had to issue 7 penalty infringement notices for border-related breaches, and we're still seeing large numbers of people being turned away at our border. So please make sure that you go onto the Queensland Health website, that you go on and apply for your border pass prior to arriving at the border, whether it be air or road, and it'll make the process a lot streamer. But you will not get in. We are checking 100% of vehicles and 100% of persons entering the state. So please, if I could ask, that work with us at those points and it makes the process a lot smoother. Thank you.
Dr. Young, the close contact with the aviation worker, is that a fellow worker who works at the same facility?
No, it's someone who's attended for training at the facility.
Right, okay. And the truckie from New South Wales, who we're not saying is a new Queensland case,
Yes.
he tested positive in New South Wales and lives in Queensland.
Yes, well, he lives across. He commutes regularly with his truck between the Gold Coast and Sydney. He drives up and down.
He must, given the exposure size of the places he's been that you read out, that must be a real threat.
Yes, that's why I'm asking everyone in the Gold Coast to immediately come forward, any symptoms at all, to make sure you get vaccinated, and the numbers coming through those vaccine centres have been excellent, and to wear masks and to just be alert that this is an increased risk.
Dr. Young, at the moment Queenslanders obviously are sweating on lockdown, but can you sort of explain why you're comfortable at this stage to not go into lockdown?
I can't say I'm comfortable. I'm watching this very, very carefully, and I'm just asking, because Queenslanders have done such a fantastic job with our last few outbreaks, with wearing masks, with coming forward and getting tested, that at the moment I'm prepared to wait and see if we've got any local transmission. Because at the moment, all of these cases we've got are linked. We know exactly how they've got them. We have got fantastic contact tracers. They've honed their skills beautifully, so they're getting hold of all of these people and getting them into quarantine. And I know that people in Queensland fully understand what quarantine means now, and they adhere to it. So, plus, the most important thing, I am steadily, every single day, seeing the vaccination rate increase.
So they're all linked, but the truck driver from South Brisbane, the guy at the Gold Coast, how are they?
They got it in New South Wales. Yes, I know they've been in New South Wales, and that's where they've got
The
it.
aviation worker?
He's got it at the aviation site, at the training site. So I know where all these people have got their cases. I don't have a random case in the community that's popped out of nowhere.
So there's not some super spread
No.
out there?
No.
Would that be the trigger?
Well, no, sorry, that's not right. People can super spread,
Sure.
although I
There's
know,
not one person
but there
that you
isn't,
don't know about.
there aren't cases sitting there that I'm being told about that I can't immediately say, oh yes, that's related to that, that's related to that.
How long has the aviation worker in close contact infectious in the community?
I'm still, I actually got this information just in the last hour, so I'm just working through all of those specific details, but I understand it was at least 3 days.
What would trigger a lockdown if we start seeing unlinked cases popping up?
If we see large numbers, so we see spread, and definitely if we start seeing unlinked cases that I can't say where they've come from.
Dr. Young, you said last week there'd been teething issues with the quarantine line coming up. Is that all working fine now, given there's quite a lot of close contacts that have been seen behind?
There have been issues, and mainly in terms of our ability to explain to people why we need them to do this and what they need to do. So yes, that's all being worked through. So I'm very grateful for the people, because it's a trial, and people have been feeding back information to us so we can then amend our processes.
I can probably update on that too, Lydia. So we're making sure we refine the communications up front, but I have been advised that everyone who is in the system and is now receiving those text messages with the link, that there has been 100% compliance with those people who are getting those links now. So it's just making sure that families understand who's getting that and what they do, but once they're informed of what their response is required to be with those links, we are getting full compliance, which is fantastic. So again, thank you to everyone who is in home quarantine, who is doing the right thing, and for those who are working with us on our new home quarantine check-in system, because we're getting such great compliance. It's wonderful news.
How many people are in home quarantine?
I would have to check the update on that because it changes every day.
1,086.
There we go, 1,086. I suspect that number's going to increase rapidly because as we put those exposure sites up and people come forward and contact Queensland Health, they'll be identified whether they're a close or a casual contact and whether they need to go into home quarantine. But I understand there's around 300 people who work at the training aviation facility. So they'll all have to go in. Queensland Health will determine whether they're all close contacts or not, but we should expect a lot more people will go into home quarantine over the next few days.
Has any health advice changed with respect to the NRL Grand Final and any restrictions that we might see on that?
Not at this stage. As I say, this most recent case, being the close contact from the training aviation facility, we have got in the last hour. So that's why we're taking the steps we are in relation to the Gold Coast, but there's a lot more work to be done over the next few hours to understand this person's movements and the risk. But I believe Dr. Young wants to add to previous question.
I think I wasn't clear. I've been living and breathing this since last night, getting the whole genome sequence. So the gentleman yesterday that we weren't sure where he acquired his infection, the man in his 30s, yes, we've absolutely confirmed that he came up from Sydney on the 16th of September. So that's why I'm very comfortable. He's acquired this in Sydney. He lives in Sydney. That's his home address. and the whole genome sequencing confirms it.
This is a guy from South Brisbane, the guy from
No, this is yesterday's case. So yesterday I announced 2 clusters. I announced a truck driver, but we weren't sure about his details because we hadn't had much opportunity to talk to him. I now am sure of those details, so he's definitely a truck driver who arrived into Queensland on the 16th of September and actually has a home address in Sydney. So he's acquired it there.
So how was he able to stay in Queensland? Because I thought the direction was once if you're a truck driver coming to Queensland, do your business, then leave again.
Yeah, so police are still looking into all of the details of about the border pass he used and so forth. But I'm quite confident in my mind where he's acquired the infection, and whole genome sequencing has proved it.
Close contacts with the truck driver at one of the hotels, you said. Is that from Analong guest?
Yes. So they've all gone into hotel quarantine, and this stage they've tested negative.
Is the border bubble in jeopardy again with the cases in Byron Bay that reported?
Yes, and also our truck driver today travelled through Byron Bay and Ballina while infectious. So we'll just have to work through what that means. I don't know. That is a decision that New South Wales will make. They have all the information and they'll work through that. And depending on the decision they make, we of course will respond.
You said yesterday you had a reasonable level of concern. Is that increased, decreased, or about the same?
It's increased.
And does the fact that this aviation worker and his contacts are fully vaccinated, does that kind of give us some insight into what it might look like past 70-80% vaccination rates in terms of your concern?
Not really, because we've always known that just because you're vaccinated, you can still pass it on. The point is, if you pass it on to someone who's vaccinated and they get it, their risk is quite low of having severe disease. So that's why being vaccinated when people in the community aren't vaccinated is insufficient protection for the community. But once the community's all vaccinated, we will get virus circulating and people will get sick, but the chances of them needing intensive care and dying from the disease are enormously lower.
Do you expect we'll get to that point by the end of this year? Do you expect we'll get to that point by the end of this year that you've described, when the virus is circulating with people aren't getting sick?
I think it might be earlier than the end of the year. I mean, we're getting, as you can see, cases every single day coming into Queensland. And they'll continue to come when we've got large numbers of cases just on the other side of our border.
So on that trucking you came up from Sydney, why aren't police involved and
Because I would like to know the border pass that he came on. I mean, we do have a new freight protocol, which I think will help a lot. That was announced yesterday. I think that makes it very, very clear what we're asking of truck drivers.
Your comments from earlier in the year about the risk of AstraZeneca to young people on some protest versus Melbourne. Are you disappointed to see that occurring, and has that changed your mind on whether the comments were appropriate at the time?
I firmly believe that younger people, and I said 18-year-olds in that comment, should be getting Pfizer. I do not think they should be getting AstraZeneca, and we have plenty of Pfizer. And they can come out and get Pfizer now, or Moderna.
Just Dr. Do you think Dr. Christmas would be a good replacement for Chief Officer?
It hasn't been formally announced, but if he were to be appointed, he would be superb.
What makes him superb?
Because he is a clinician. He's a very good clinician. He's been heading up our clinical response at the Royal Brisbane and Women's Hospital, and I've used him to work with other hospitals across the state. You know, we have 5 networked hospitals for the management of COVID. Our hospitals have done a superbly fantastic job at managing cases of COVID in Queensland. We've seen that. We've had, unfortunately, 7 deaths to date out of over 2,000 cases, but that excellent response is due to the work our clinicians have done, and he's been a lead in that. And we are going to end up with cases going forward. This will be endemic in Queensland, in Australia, in the world. So we need to be prepared to manage cases of COVID. So he would be a perfect person, but it has not been announced. We will wait and see who the next Chief Health Officer is. Thank you.
Do we know
Yeah, because one of the cases went there and got tested.
Can I just ask the Health Minister, are you concerned about more truck protests being placed and discussed?
Last question.
Look, we've been working very closely with the freight and trucking industry, who have been supportive of our announcement yesterday of mandating the vaccination and the time frame we've put in place. We've worked with them about where we set up vaccination clinics as well as testing clinics to make it as convenient as possible for our drivers. We understand our truck drivers keep this country going. They keep our economy going. We must have food and produce and goods and services actually moving around this country. And so we must ensure our freight and truck drivers can move across borders and get those goods to us. But it comes at a risk, and especially when we have the largest outbreak that this country has seen since January last year. We have our largest outbreak ever on our doorstep right now, with 3 jurisdictions across the east coast of Australia now with large outbreaks. So over 300 people have died, over 60,000 positive cases, again, from one person back on the 16th of June. So we do need to make sure that we are reducing the risk as much as we possibly can by having these drivers vaccinated. And I ask those drivers, please work with us, because this is about keeping you safe, your loved ones safe, our community safe. And if you as a truck driver are thinking, should I or shouldn't I get vaccinated, can you think of the health workers who go to work each and every day, who put their lives on the line to treat positive COVID patients, to be the ones to hold their hands when loved ones can't, who are at risk of taking it home to their own children and their family and their elderly parents. They are the front line who put their lives at risk for us. But if you choose to do this job unvaccinated and drive through areas that have high levels of virus, then you are saying to those people their jobs aren't as valuable. Let's make sure we're doing it for our frontline health workers. Thousands and thousands have died of health workers around the world to try to keep us safe and to save other lives. I don't think it's too much to ask for that you go and get a vaccination, at the very least, to keep them safe and to protect their jobs.
Minister, are you
Thanks.
concerned about the number of healthcare workers yet to be vaccinated with the deadline week?
No, look, we're working through it with all of our health workers. We know that this is critical. We require our health workers to get vaccinated for a range of immunisations and the flu. So this is not uncommon to require health workers to be vaccinated. But we do need them. This is about keeping them safe, their work colleagues safe, every patient and visitor that walks into their hospital, and their own family members. So we do need them vaccinated. I hope the health workers, and I know the majority are stepping up and getting vaccinated and doing the right thing. I hope that they do realise that this is a priority. The reality is this is where it's going across the country. If you are a health worker wanting to work in a health sector, whether you work in aged care, whether you work in public health, whether you work in Victoria, New South Wales, other jurisdictions are doing this. So if you want to work in the healthcare sector, you're going to need to be vaccinated. So don't wait. Do it now, keep yourself safe and help protect the community. Thank you.
Very last one.
Dr. Young mentioned that she asked for the police to look at the circumstances around the truck driving yesterday. Can you give any indication of detail on where that investigation is at?
Look, that's not unusual. Every time that we do get a case from people crossing the border, the police will look at the procedures, look at the border pass that was applied for and how the person entered the state, and we're doing that this time. So I can't give you an update at the moment, but from yesterday we've engaged with Queensland Health. We've got those details and we'll look at those details as to how we got the border pass.
So it seems like something has gone wrong, doesn't it? Because he shouldn't be staying for so long.
Well, that's the stuff that comes to our attention once this occurs. You know, we've had the outbreak, we've got the positive case, and now we go back with Queensland Health and we look at all the circumstances of how that occurred. We actually look at the circumstances before he enters the state and how that person entered the state, and then what they've done within the state, and we look at that against the public health directions.
Got to go now.
Thanks, everyone.
Thank you.